Thanks, Sandy. We went with a little bit more of a vignette style set. So as others have reported out, we'll be reporting out our results per vignette and giving the highlights for those. And I'll have some of our implementers joining me so we'll have multiple presenters today. Just quick background, PACIO, of course, is the post-acute care interoperability project. We've been working since 2019 to bring together stakeholders across industry, government, and different healthcare systems to work on healthcare data exchange related to post-acute care and the eye chart of all of our members. And a number of these folks were participating this time around. Real quick, the objectives. We were focused on testing a couple of our IGs, making sure that they still conform to US core, since that's going into effect these days, as well as continuing to iterate and move things forward. The standard medication profile is objective 1, and we're focused on really looking at how we can continue to advance that and include a medication action plan to talk about how the medication reconciliation should be done and why it should be done. The second objective, our personal functioning engagement IG, we were leveraging that to be able to do some SMART-on-FHIR transmission of assessment data through the questionnaire and questionnaire response. And finally, really starting to lean into Inferno testing so that our members can start testing their own instantiations, but really, in addition to working on their servers, really looking at the bundle structures that they're creating to make sure we're able to pass conformant data. The biggest part of this is our participants and attendees. We're really thankful for everybody that participated. Folks that participated across and did a lot of the testing and demonstration included actual meds focused on that medication action plan. The REMS team was working with some of the standardized medication profile, and they were looking at how to trigger their processes through integration with the transition of care and standardized medication profile. Global Alliance was looking at that SMART-on-FHIR, and MITRE was doing a lot of the back-end stuff as the PACIO program office. We also did have a chance to leverage a couple of our resource partners. Point and Click Care we've been able to start interacting with them and started working with their FHIR sandbox. This time just an extract, and next time we'll have that integration up and running completely. And then, of course, MELD servers. We had a lot of folks participate across the 2 days, so we had over 40 individuals and 20 companies. And we also had some ad hoc testing participants. Care Commons was looking at some of our Inferno testing, and Patient-Centric Solutions was coming back in behind some of the other demonstrations and seeing if they could pull in the data and immediately start working with it, which they were able to. With that, for the first vignette, I'll turn it over to Jessica Skopak from Global Alliance.
Thank you, James. My name is Jessica Skopak. I'm the founder of the PACIO project and the director of health policy and interoperability at Global Alliance. Before I jump into what we were able to accomplish during the Connectathon, I want to share just a little bit of information about what a Promise 10 is and why it is important. Promise 10, or the Patient Reported Outcomes Measurement Information System Global Health Short Form, is a brief 10-question standardized questionnaire developed by the National Institutes of Health to assess a person's overall physical, mental, and social health. Because it is so brief yet comprehensive, the Promise 10 is commonly used in clinical settings, research, and population health studies to monitor well-being, track outcomes, and inform treatment decisions. The Promise 10 items are scored to generate 2 summary scores, a global physical health score and a global mental health score. In this vignette, our patient persona, Betsy Smith-Johnson, who many of you may be familiar with from past Connectathons, is completing a regular checkup appointment at her primary care provider, during which her provider becomes concerned that she may require some additional support and suggests that she might be a good candidate for a government program which would provide funding for additional services that she requires. So Betsy's PCP is asking her to complete a Promise 10 survey, which she does in the waiting room of her provider's office. She completes and securely submits the results of her Promise 10 survey to the government program on a tablet powered by a web-based SMART-on-FHIR application, while simultaneously transmitting the results to the PCP's EHR. The benefits in this case of a SMART-on-FHIR app are that really it allows Betsy to complete the form independently, which reduces a burden on the clinician who no longer has to spend the time asking each of the questions and capturing the responses during the visit. And also, while in this scenario, Betsy completes the Promise 10 in the waiting room at her primary care provider's office, if she were in a hurry or if the PCP wanted to assess her progress in between visits, she could take that link home with her and access the web-based app on her personal PC, tablet, or any mobile device at any time. This also, the SMART-on-FHIR technology allows the PCP the ability to securely and easily transmit her progress to her mental health provider and perhaps to her home health agency to promote more coordinated care. So using this vignette as the backdrop for our testing, we successfully demonstrated completion of the Promise 10 and transmission of the responses simultaneously both to Betsy's PCP's EHR and to a sandbox representing a government server via that web-based SMART-on-FHIR application. Also, we calculated both the raw and the t-value summary scores for global physical health and global mental health in the FHIR questionnaire, which were then converted to summary scores from multiple questionnaire responses to FHIR observations using the Personal Functioning and Engagement IG, and displayed those results as trend data in a graph, which I'll show on the next slide. Finally, one of our ad hoc participants, very in an exciting kind of late-breaking development, was able to ingest and display Betsy's Promise 10 responses in the Patient-Centric Solutions Health Record, which is designed to promote data sharing, like patient-directed data sharing. So next slide, please. Here are some screenshots from the Connectathon. On the left, you see the SMART-on-FHIR application UI, where you have the drop downs for each of the 10 questions. And then at the bottom, after you hit submit, you have the health summary scores, both the raw and the t-score values. On the right, you can see the patient-centric solutions UI, which integrates Betsy's Promise 10 results over time. So all of the different occasions on which she completed the survey so that they can do their own trending and mapping within that software, and also tie it back to a lot of other health information associated with Betsy, such as assessments, her lab results, vital signs, allergies, all of those kinds of things. And here we have some more screenshots demonstrating the display of the information once it's been transmitted to our pseudo EHR, which then is converting the information into those FHIR observations. And on the right, you can see the observation trend chart, which displays her global physical health score. And you can see that at each point in time where the survey was readministered, it seems that maybe the additional services that she is receiving are providing some benefit because her scores are improving over time. So that is the exciting work that we were able to accomplish on Promise 10 in the PACIO track.
Moving forward to our next vignette, Anne-Marie Bernanke from Actual Meds will give us the readout on this one.
Great. Thanks very much, James. So I'm Anne-Marie Bernanke. I'm a co-founder and the Chief Technology Officer of Actual Meds Corporation. Actual Meds provides a turnkey software as a service and or software-powered turnkey pharmacist on-demand service for the payer managed care ecosystem in providing medication reconciliation, medication risk assessment services for a variety of use cases, including care transitions for a variety of different inflection points across the care continuum, particularly from acute to long-term care. Also, additionally, medication risk assessment for adherence, chronic disease management, specialty programs such as chronic kidney disease, et cetera. We've been pushing Interoperability as a core tenet of ours from the very beginning, because we take in a variety of different data sources, contextualize and harmonize them to present a landscape and let pharmacists be pharmacists, not data curators, not documenters. So we take extraordinary quantities of data. In that contextualization and harmonization, we present it in a visual heuristic that lines up different medication sources, enables automated smart risk assessment from a variety of different risk rule libraries, and then also supports automated workflow around different inflection points in the medication reconciliation process and automated documentation and analytics to support providing guidance in the form of medication action plans back to the care continuum based on that pharmacist risk review. What we demonstrated in this vignette was an extension of multiple prior PACIO Connectathon participation opportunities where we've extended what we've already done with FHIR. We're also using FHIR in a variety of commercial interfaces currently across different clients and use cases. But in this particular context, we extended a FHIR implementation to set up real-time polling of the PACIO FHIR server. That was enabling us to do the pickup of the admission, discharge, and transition of care content based on the Da Vinci discharge notification.
Big thanks
so the
to
pseudo
Tooth
EHR was
Apps
set
and
up
their
to
incredible
send us,
work,
or it's
as well
basically
as
post new information for
as
Betsy
the
Smith-Johnson.
other two firms that were
Our
there
polling the
as well.
system was let us know that a change had been made, so we were able to pull down that information, a fully qualified standard medication profile for Betsy. That included, of course, demographics, condition allergy information, and of course, her medication profile. That information was ingested into our system to facilitate a pharmacist review. Risk was assessed, and then outputs documented in terms of medication action plans that could then be sent back. So those in turn were packaged up as a medication action plan bundle against the MAP IG and sent back with structured data as part of the MedRec workflow. A couple things that we discovered in this latest iteration of work is that the MAP IG, is got some maturing going on. So there were several successive iterations around best practice for implementation. A lot of discussion that can maybe come up in any Q&A if May, Terry, or Pete are available to also comment on it regarding what was the best way to structure the bundle. What goes with what, how is it nested? So there's some maturing that needs to happen with the IG, and that did necessitate a certain amount of iteration on the path through this Connectathon. So that said, looking across the scope of the past several Connectathons, I think for us, a lot of what's happening next and working with PACIO in really sort of stretching what we can do with the SMP and MAP IGs to support and document pharmacist-led interventions injected into the care continuum via FHIR is to continue to stabilize, leverage Inferno and other open source test harnesses to really poke and prod at making sure that code reuse and portability, which is really one of our intrinsic goals with promoting the FHIR standard, is something that we are all collectively better able to demonstrate. In past PACIO Connectathons, we've had a certain amount of iterative custom work that's been needed. And I think driving toward code reuse and portability that's more durable is something we'd like to see and continuing to work with the PACIO group. So we have a couple of screenshots that follow. This shows the inbound medication list as it's ingested into our system coming through. Sparse data for purposes of really demonstrating and probing the SMP implementation. So we can work in next iterations with richer data sets, but we can pull in one or more channels that's displayed the ability to deep dive into the details of medications is provided so that everything is structured and carried forward as portable a way as possible. And then subsequently the documentation of the action plan in a series of structured fields, some of which necessitated some recommended expansions to the implementation guide in terms of really structuring and not making the action plan free text, but more of a consistent, repeatable framework.
All right,
Great.
thanks, Anne-Marie. So real quick on the last vignette that we did, including the Codex Risk Evaluation Mitigation Strategy project. That is a medication overview oversight project that includes a lot of different engagements between prescribers and the REMS administrators. They've been working hard to get that up and running, and we're looking to expand that into a more full demonstration. So we participated in a scenario where somebody was prescribed medication prior to an accident. So a PCP had prescribed, they went into the emergency room, but then we're going to have to stay at a skilled nursing facility for an extended period of time. And looking at that transition of care information as it went across to the skilled nursing facility, pulling out the medications and being able to trigger that action for the new prescriber, and then again roll back into the existing risk evaluation and mitigation strategy system for the new prescriber. And that went really smoothly. All of the regular REMS operations worked perfectly, and the exchange of that data, again, leveraging that Da Vinci discharge notification and the polling system allowed them to automatically pick that up and start moving forward through that whole process. The REMS team was really excited, and the standard medication profile side, the PACIO side, is really excited about that interaction. So we're going to continue that forward to make that a stronger connection in the future. Inferno Test Kit, as noted, we've been developing these across all of our IGs, and this really helps us focus on making sure that all of the data bundles and resources that are going out in FHIR can be tested, and that folks that are implementing can see how it's going. Last one, and then I'll get off the stage, is we were able to do a demonstration of the transition of care assisted by an AI agent system. So we were doing AI assisted generation of transition of care data. We have an initial prototype, but we have a lot of things next to explore across from looking to open source it so that we can engage with the community more and making it more flexible using other LLMs and containerizing and all the things that will make it more applicable. The last one to note, as our next presenters will be touching on, is leveraging PICI to try and get a little bit more structure around including US CDI in this. Since US CDI is so loose, the PICI framework really helps us to be able to really pull this all together and make it quantifiable and more quality driven. I think that was it. Thanks.